The cost of cancer drugs has been dramatically on the rise within the past decade without signs of slowing. This is not a widely discussed issue due to its sensitive nature. People believe that prices should not be considered when talking about someone's life. It's understandable. However, cases of patients with metastatic cancer, which is terminal, the implications of these high prices should be discussed. High drug costs could be a great harm to society. By increasing the cost of accessing healthcare, by raising costs of owning insurance, and by increasing the Medicare contributions. I believe creating a governmental board to evaluate these prices would be essential in tempering these rising costs of cancer drugs. A study by New England Journal of Medicine showed that 81% of patients with advanced colon cancer did not know the drugs would not cure them. This study poses a hurdle and created a national dialogue in the drug pricing. People do not understand these drugs are not a cure. These drugs are just prolonging the inevitable death of the cancer patient while enriching drug companies. While these high prices are causing the average American to see increases in their health care while seeing decreases in their healthcare services. However, these costs of these drugs are not well known. In 1965, vinblastine, a cancer drug to treat melanoma, cost $78 a month. In 2011, Yervoy, a drug also to treat melanoma, costs $38,000 a month. And the patient must receive a 3-month treatment of this. So the patient has a total cost of over $100,000 for a 3-month treatment of this drug. And the insurance companies and Medicare pay this. But you know what? They pass the cost on to the consumer by raising healthcare premiums and decreasing their services at the same time. Zaltrap, a drug to treat advanced colon cancer, costs $11,000 a month. It is only used in combination with other drugs. The median survival rate of Zaltrap is 42 days, meaning the average person will only live 42 days longer while taking this medication. The higher end of the spectrum is 100 days. And this $11,000 a month is not even factoring in other costs, such as the fee the doctor charges, or paying the nurses to administer the medications, or the cost that of actually administering it, IV tubing and stuff like that. The rise of drug prices is complicated and has many factors. One factor is that doctors prescribing drugs that are very expensive without any substantial benefit over a cheaper alternative. Another factor is Medicare paying the cost of the drug company sets. Medicare has no ability or rights to negotiate pricing with drug companies. Another factor is patents. A drug company comes out with a drug, they own a patent on it, and this patent allows them to charge whatever price they want to charge. And you know what? The drug company will charge whatever they want, and it will be a high price because the drug companies do not owe anything to the cancer patient or to society. The only thing they're meant to do is to maximize their profits for the shareholders. And the thing is, the price of medication is no indication of their effectiveness. One of the most popular medications to treat advanced colorectal cancer is 5-fluorouracil, which is better known as 5-FU. It was developed in 1957 and costs about $30 a treatment. And it's very comparable to other more expensive drugs used to treat colorectal cancer. You would think with advances in sciences since 1957, drugs would be more advanced and effective, but this cannot be proven on a consistent basis. And there's a reason for that. There is no pressure for a drug company to take risks or be innovative. If a company can charge $11,000 a month for Zaltrap, a drug to treat the colorectal cancer, if it's not any more useful than 5-FU, which costs $30 a month, why would they take the extra risk, the extra time to study and create a more effective drug? There is no incentive. According to IMS Institute for Health Informatics, drug sales in the U.S. reached $26 billion in 2012. And it's estimated by 2016 it will be $85 billion worldwide. Until these drug companies have incentive to be different, they'll continue to pump out marginally effective drugs that have no intention of saving a cancer patient's life, but continue to drain money from the government, the American citizen, and the dying cancer patient. England adopted a committee known as the National Institute for Health and Clinical Excellence, better known as NICE. This committee considers the cost benefits of drugs and treatments in healthcare. The results were lower prices in cancer drugs. And this committee would not allow certain drugs, certain cancer drugs, to come out on the market if they cannot be proven to be any more effective than cheaper alternatives that were already out on the market. And you know what? This made drug companies to go back, lower the prices in England, so they could get on the market, so they could get into the England market. The result of such a committee like NICE could be best displayed by comparing price disparity of the drug Tasigna. It's a drug to treat chronic malignant leukemia. In England, a year supply of Tasigna would cost $33,500. Sounds expensive, right? Yeah, very expensive. However, in American, for the same exact drug, the same amount of time, 1 year, would pay over $115,000. Triple the price. It's unacceptable for this sharp of contrast in drug pricing. Eventually, the continuing rising cost of drug prices will catch up with us. As a people, as a society, we seem to be more reactive than proactive. And the emotional nature of medicine used to treat a dying cancer patient makes it hard to be very vocal on this issue. It's understandable. Many people know someone that has died or is dying of cancer. And people do not want to speak up about the prices. But if the prices spiral out of control, it's not just the cancer patient that's going to suffer. It's going to be all American citizens. Parents may not be able to afford healthcare premiums to support their children. Medicare may cover less and contribute less to the healthcare of the elderly. That's why I'm an advocate for a board similar to the one that's in England. This will help rein in the costs by capping the costs on the prices that drug companies are allowed to set on these drugs. And the price should be in direct correlation with their effectiveness. I think this would also give an incentive to make a better drug. They have to make it better than what's already out there. They just don't come up with another drug that's the same effectiveness, just with a different name. And also, this board should oversee doctors who prescribe more expensive drugs that show no greater benefit than cheaper alternatives. Terminal cancer patients are desperate, and they deserve better. They deserve better than these overpriced, underperforming drugs, but they will get no better unless we, as a society, demand it.